I'm Dr. Pete. What is bipolar disorder? I'm going to talk to you about what bipolar disorder is. This is one of those terms that's thrown around like Kim Kardashian wants to be with a bunch of black men. But it's something that most people don't even know what it is. So let me start off with, there are two types of bipolar disorder, bipolar 1 and bipolar 2. In general, bipolar 1 tends to be more of the up, so people who are more energized, but again, energy is not bad, I'll get to that in a second. And bipolar 2, they're more down, so more depressed. Certain types of behaviors that are really common in really any bipolar disorder, whether it's 1 or 2, would be some of these risk-taking behaviors. That could be driving really fast, it could be compulsive gambling, it could be drug use, sexual behaviors that are more promiscuous. Also, these people, they tend to be, at any given time, could struggle with money and how they're spending money or just budgeting money. And so with bipolar 1, people tend to spend more time up here. Other issues that they have and concerns that we're concerned about are they sleeping enough? Are they at risk or danger to themselves or other people? Bipolar 2 are people who are more depressive. So bipolar 2 is more difficult to diagnose because it looks like depression, and it's also more difficult to treat. So when you think about these two in particular, all right, this conversation is in the forefront now because of someone like Robin Williams. So unfortunately, it takes these tragedies that we then have to see and have this conversation about what bipolar disorder is. Many of these articles are saying he was either depressed or bipolar disorder. I've never met him before, certainly never treated him. We wouldn't be able to tell you if I did anyway, but he probably presents more with a bipolar 2. So somebody who on interviews is always up here and all over the place and really energized, and probably, especially through his comedy, spent a lot of time down here with the depression or the darkness. Now, this is also really common for people to spend most of the time down here, which is why they're diagnosed with depression. Now, one thing that's important to know, and especially with Robin Williams and the suicide will often occur when people are up here. So it's really sad, it's an uncomfortable conversation, but even though you might think people are more likely to commit or attempt on their life when they're depressed, it's actually more likely to happen when they're up here and what we call manic. I will say there are many professions where there's peer support, so like athletes or the military or law enforcement, where people call each other out, and there's EAP, employee assistance plans, to say, hey, come on, I need you to step up to the game, you're using too much, it seems like you're not okay, you're not yourself, let's get some help. I think celebrities can do a better job with that. There have been several celebrities recently, and certainly across the history, that everyone's watching them, and certainly tabloids today and social media, we all know what's going on, but who's really there to help them? I think we can do a better job. The best course of treatment for bipolar disorder is medicine in conjunction with counseling or therapy. So the medication for sure is one of the first things that we need. In fact, it's one of the signs that we would look at as a professional. If somebody I'm treating is like, oh, I don't want to take my medicine anymore, that's usually a sign that it could be bipolar disorder. Medication compliance is challenging, but it's essential and it's necessary. Now, in Robin Williams' case, I don't want to go back and forth too much, but with Robin Williams, with this, if in fact he had bipolar disorder and was medicated, the diagnosis of Parkinson's could also complicate things further. So biologically, Parkinson's can impact the neurology, but also just the psychology of hearing that type of diagnosis. I'll leave you with this last point. Bipolar disorder is also known to be genetic. Now, in our field, there's no clear-cut, like this gene causes this, but we certainly see familial patterns, so family patterns of people who are diagnosed with bipolar disorder. So be careful and embrace your loved ones. But that's bipolar disorder, and I'm Dr. Pete.